All right, so we're going to wrap up our skeletal system lecture by looking at the lower extremity, starting with the femur. So on page 69, we're starting with the femur at the bottom here. And so this is the largest and longest and strongest bone in the body. And it can hold a lot of body weight. So this is going to be the bone that is going to accept all the body weight from our hips. Let's start by looking at the bone itself, and can we tell which one is the front and which one is the back in terms of this picture? So let's take a look at our image here. So you want to notice that the proximal end of the bone looks relatively similar, but the distal end of the bone does not. So if we look at this part of our bones, we can see a big difference where we have a flat surface here, right, on one side of bone, and we have a nice deep fossa on the other side. So the flat part, this is going to be the anterior view of the bone, and this is where the patella, or your kneecap, is going to rest. So the kneecap is going to rest right here. So that's called the patellar surface. And that's how you can tell that this bone, that's the front of that bone, or the anterior surface. When you see that fossa, that's going to be the posterior side. I can't talk and write at the same time. I'm learning my limits here. And that's called the intercondylar fossa, because what we have here are two really smooth surfaces that is going to articulate with the tibia. And the condyles, which is what they're called, these are the condyles of the femur, and they're going to, when you bend and straighten your knee, right, these are going to rock on the surface of the tibia. So these are called condyles, and the fossa is called the intercondylar fossa, because it means in between the condyles. Now, let's also look at medial versus lateral, okay? So if we can see, this picture right here, notice that the head of our femur is going to point inwards towards our hip joint, right? The acetabulum of the coxal bone. So we know that when we see the head of the femur, that this is going to be the medial side of the bone, right? So this entire surface on that side is going to be medial. And the other side is our lateral side of the bone. Why does that matter? Because when we come to name our condyles, there's a medial and lateral condyle, right? So how do you know which one's which? Look to see what side the head is on, and then that means that the condyle on the same side as the head is your medial condyle, and the opposite condyle is your lateral condyle. All right, so now that we're oriented, let's start to look at more features of our femur. Starting at the proximal end, the head, again, is this nice, smooth, rounded part, very obvious head that fits or articulates with the acetabulum of the coxal bone. Then we have a neck, right? So the narrow portion is the neck of the femur. Then we have two very large protrusions, and they're called trochanters, and the femur is the only bone with trochanter. So we have a really big superior one called the greater trochanter, and a smaller inferior one called the lesser trochanter. These trochanters are attachment sites for muscles. Between the trochanters, there's going to be either a crest or a line, and so this depends on what side of the femur you are. So if you are on the posterior side of the femur versus the anterior side of the femur, so you can see the posterior view, you have a crest. This raised, it's not completely obvious. It's if you had a real femur in your hand, then that would be really obvious. So this bridge of bone that connects the two trochanters is called the intertrochanteric crest. And then on the anterior side, there is you can see this area here. So it's a rough region of bone that also connects the two trochanters, and that's called the intertrochanteric line. Okay, so depending on what side you are, you either have a crest or a line, but they're both connecting the trochanters, and they're called intertrochanteric. Now, looking at the next topic, gluteal tuberosity. Gluteal refers to the gluteus maximus muscle of your butt. So this, if you kind of see region 7, there's kind of this triangular, very bumpy, textured region. That's the gluteal tuberosity. And as you would expect, this is where your gluteus maximus attaches. And when you extend your thigh, which is pull your thigh behind your body, then that is the gluteus maximus pulling on the gluteal tuberosity of your femur. The next topic is the popliteal surface. So I'm going to have to, oops, sorry about that, go down to the distal aspect. So the popliteal surface is going to be that surface we talked, I'm sorry, popliteal. Popliteal is on the back. Remember, the popliteal region is the back of the knee. So now at the distal part, we have this really smooth area, right? And that region is called the popliteal surface. Or you might hear popliteal surface. The next one on your list is linea aspera, but let's just stay down here and just look at the condyles. So we have medial and lateral condyles, medial and lateral epicondyles. Again, the rounded, smooth parts are condyles, okay? The epicondyles are going to be the widest part of your femur. So they're going to be above the condyles, and just, if you were to just grab your thigh, in fact, you can do it now, just grab your thigh above your knee, and if you can feel the bone on either side of your thigh, just right above the knee, you're grabbing onto the epicondyles of your femur. So it's kind of hard to see. I'm going to go back to just the big picture here. All right, so let's do that again. So medial, number 1 is a medial condyle. Number 2 is the lateral condyle. Here is the medial epicondyle. Here is the lateral epicondyle. Looking at the posterior side, remember, so this is our posterior view. We have an intertrochanteric crest. It's a little bit nicer on this picture. This area is our gluteal tuberosity. And then the bone actually forms a ridge that becomes a line. So the gluteal tuberosity becomes this bumpy line, and that's called the linea aspera. The linea aspera is an attachment site for muscles as well. So notice the line comes down and then it starts to split, right? Like that. So when it starts to split, we no longer have the linea aspera, but what we have between is the popliteal surface. All right, so I know popliteal surface is duplicated in your list, in your lab manual, so don't worry about the second one. There's only one popliteal surface. Okay, so I think I talked about everything, actually. We are done with the femur. Let's move on to the patella. If I can manage to use, okay. Before moving on, just a quick, fun X-ray images of a broken hip, and not fun really, right? But for the person here. But notice that, you know, here's the head of the femur that we can see. Here's the acetabulum of the coxal bone, and the neck is broken here. This is the most common area. When people break their hip, the neck is the most common region that fractures of the femur because it's the weakest point. It's narrow. So what people do for hip replacement is they can actually put in some hardware. So everything that's very white here is going to be metal or titanium or something like that. And they're going to, there's different kinds of, methods, but this one is creating a brand new head. So the head of the femur is now artificial. The neck is now artificial. And they're using the rest of your bone. They're driving this piece of metal into your femur. So it kind of hooks into your femur that way. So this is what's known as a partial hip replacement. All right, moving on to patella. So patella, there is several features of it. So the base of the patella is going to be the flat surface on the superior aspect of the patella. So the patella is going to face down. The apex, which is the point, is your inferior aspect. So the apex points down. So the flat part of the patella is on the superior, and then the apex goes down like that. The anterior surface of your patella is very rough. So if you just take a look at the surface, right, that's very rough. But the back, the posterior surface, is smooth because you never want rough bone to contact bone. You want smooth bone to contact bone. So keep that in mind. The posterior patella, which contacts the femur, is going to have two facets or facets. You're going to have a lateral facet and a medial facet, and they're both going to articulate with the condyles and also that patellar surface of the femur. So the lateral side is larger. It doesn't seem that way in this picture, but the lateral facet is the larger one. So the letter L for lateral and the letter L for larger. I think that's all we have for patella. All right, moving on to the tibia. So your leg, now we are at the leg. And the leg has two bones, just like your forearm has two bones. The tibia is going to be the medial bone, definitely know that, and the fibula is going to be the lateral bone. They're going to articulate with each other, proximally and distally, but they don't move, right? They're bound together by tendons, ligaments, and membranes. There's an articulation point here. There's an articulation point here. So let's start with the features of the tibia first. All right, so we're looking at the proximal end of the tibia, and we want to look at the condyles. So again, condyles are going to be smooth parts of a bone that articulate with another bone. And the tibia is a little special because the condyles are flat. I don't have really a beautiful picture of the condyles, but if you take a look at this image, right, the condyles are the parts of the bone that contact the femur, and the surface, I don't know if you guys can see in this image, but the surface is smooth on the top here. So those smooth parts are considered condyles of the tibia. Now, how do you know which one's medial and which one's lateral? So this is the trick. You have to look at the distal end of the tibia. So let me show you the other picture. Oh, this is actually good. The condyles are flat, right? You can see how smooth that surface is. So let's look at the whole tibia again. You can't really tell which one's medial and lateral by looking at the top. You have to look at the distal end of the bone and look at the difference here. So I'm going to remove my markings. Notice that the tibia has a part that comes down farther than the other side. That is your medial malleolus. Okay, the name medial is in the name of that feature, medial malleolus. So it comes down like this, right? So if you see that, you know that the same side is the medial condyle. So the next term on the list is intercondylar eminence, which are little tiny bumps between the condyles. So you can kind of see them here. There's a bump here and a bump here. If we go to the other picture, it's number 1. There's a little tiny bump here and a bump here. If we look at another image of those intercondylar eminence, you can kind of see, not the greatest, but there's little bumps that stick up. This is the better picture. So those intercondylar eminences, if you're familiar with ACL and PCL, there's where those ligaments will attach. Next is our tibial tuberosity. So the tibial tuberosity is on the anterior surface of the bone, and it is, I'm trying to move my picture here. I'm sorry for this is probably bugging you. The tibial tuberosity is a bump here. And again, it's a tuberosity, right? Tuberosities are going to attach muscles. And this is a really big one, and the attachment is going to be your quadriceps. So the tibial tuberosity is a large protrusion attachment site for the patellar ligament, which actually is a ligament that is going to help tie your quadriceps. So a lot of people just call these quads, the muscles on the front of your thigh, to the tibial tuberosity there. Next, after we pass the tibial tuberosity, we're going to have the bone comes to a point. and the point is going to go down the front of the bone like this. So number 4, where I'm going down, this is called the anterior crest. I like to say crest, but you can also call it anterior margin or anterior border. In terms of the word interosseous border on your list, you can cross that out. I'm not going to ask you interosseous border. All right, so let's take a look at our next term. Our next term is medial malleolus, which I did point out before. The medial malleolus, which is the part of the tibia that goes down. And then the next column in your list, we're going to cross out 2 terms. We're going to cross out facet for head of fibula, and we're going to cross out facet for talus. The only other thing that's left that I want you to identify is the fibular notch. And the fibular notch is what's pictured in this little guy, little image on the right. So notice that the fibula is going to articulate with the tibia here, right? There's going to be a little notch on the tibia so that the fibula can fit. And that's what you're looking at in this little picture. So this depression, right, on the tibia is called the fibular notch. The fibula is going to nestle right in that little notch. All right, so that's the end of our tibia. And by the way, just one thing to think about, and actually you should know this for the exam, the tibia is your weight-bearing bone, right? So take a look at your 2 leg bones. Which one is the larger of the 2? It's your tibia by far. The tibia is what the condyles of the femur, the condyles of the femur are going to rest on. So your femur comes down, condyle will rest here, and another condyle will rest here, right? So the condyles of the femur are going to rest on the condyles of the tibia. So all of the weight of your body from your thigh will be transferred to the tibia, not to the fibula. The fibula is a very small, weak bone, relatively thin bone, and it's for attachment sites for muscles that help to move your ankle and your feet, but it does not bear weight. So your weight-bearing bone is the tibia. Let's also look at your ankle bones before we get down to look at the fibula. Your ankle, if I said, put your hands on either side of your ankle bones, you would be putting your hands on these 2 malleoli, right? So on the medial side of your leg, you'd be putting your finger on the medial malleolus. On the lateral side, you'd be putting your finger on the lateral malleolus. Okay. So let's take a look at our fibula. So our fibula has 2 ends to it. It has a head, and then it has that lateral malleolus. The head is going to be relatively flat, all right? And then the head will have a neck, the narrow part. So you can see how the fibula articulates with the tibia. It's actually underneath the condyle, so it doesn't bear the weight. As the weight comes down from the femur, it's transferred only to the tibia. The shaft is everything else, and then the lateral malleolus is a little bit more pointy, and there is a little fossa that is underneath here. So this is the tricky part about the fibula, because the head and the lateral malleolus look very similar, but in general the head is more flat, and the lateral malleolus is a little bit more elongated. And then it has a little baby fossa on the anterior side. All right, so that is our fibula. Notice again how these form a joint of our ankle. And again, where's the weight? So the weight is coming from the femur to the tibia. The tibia will transfer that weight onto your feet. And the tarsal that accepts the weight is called the talus. Okay, so let's take a look at your foot now. Here's the foot, your superior view of the foot. Notice, where's my smooth bone? Right here, this is nice and smooth, so I know this is going to articulate with my tibia. So the tibia is going to transfer weight onto this bone. This is called your talus. Okay, so now when you move your ankle, what are you doing? You're pointing your toe up, you're pointing your toe down. So you have this up-down gliding motion, right? And so we can see this kind of gliding motion in the shape of this bone, right? So you can glide up and down like this. So this surface that allows you to do that gliding motion or the hinging motion is called the trochlear surface. So the talus has a trochlear surface. So if you turn your attention to the outline, notice the first bone there is talus with trochlear surface, and these are your tarsals. So let me back up just a quick second. Let me erase these. All of the short bones you see here as a group, they are your tarsals. Then the first set of long bones are your metatarsals. Then your toes are composed of phalanges. So this is the same way that your hands are organized. So the tarsals, this metatarsals would be basically the instep, I think you call it instep of your foot, where you do a lot of massaging, and then your phalanges are your toes themselves. You would name them the same way that you name your fingers. So starting with the big toe, your big toe is number 1, okay, 2, well actually you use Roman numerals, 1, 2, 3, 4, 5. So digit 1, digit 2, digit 3, digit 4, digit 5. The first set of phalanges is the proximal phalanx. We have a middle phalanx and a distal phalanx. Just like the thumb, your big toe is just like the thumb. You only have 2 phalanges in the big toe, the proximal phalanx and then the distal phalanx. And then you name your metatarsals the same way, right? Metatarsal 1, metatarsal 2, metatarsal 3, metatarsal 4, metatarsal 5. And that shaft, base, and head are the same as your hand as well. So the proximal part of the bone is called the base, the middle is called the shaft, and then the end is called the head. So just like your hand. So now let's turn our attention to name the tarsals, and we're done. So if we want to take a look at this picture here, the biggest bone you have of the tarsals is your heel bone, and that's called the calcaneus. So your calcaneus, it forms the heel of your foot. It's relatively large. And then the talus, right, the talus that the tibia rests on actually rests on top of the calcaneus. So let me outline the talus. So the talus is resting on top of the calcaneus. The talus, again, contains a very smooth trochlear surface. Okay, so the weight will come onto the talus first. The talus will transfer their weight onto the heel of your foot, the calcaneus, and then throughout the tarsals, and then throughout the rest of your foot. Now let's name the rest of our tarsals. Cuboid is a little cube-shaped one. Then we have our navicular. The navicular is fun because it's a nice round boat-shaped bone. So navicular, like navy, like a little boat. And then the rest of them are called cuneiform. And I like to call them cuneiform 1, 2, and 3, but you can also call them medial, intermediate, and lateral. So this one on your big toe, since your big toe is the most medial, this is your medial cuneiform, or cuneiform 1, because your big toe is digit 1. Your second cuneiform is cuneiform 2, because it's at the base of digit 2, or you can call it the intermediate cuneiform. Our last cuneiform is our lateral cuneiform, or cuneiform 3, because it's the base of digit 3. All right, and that is your tarsals, and we are completely done with the system, with the skeletal system.